Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Effect of atropine on intestines. On the intestines, atropine will decrease the tone of the intestine, amplitude of the intestine, and even frequency of the intestinal motility is decreased. These anticholinergic drugs are antispasmodic drugs and they are anti-diarrheal drugs. So mainly we use synthetic drugs are mainly used as antispasmodic agents. So antispasmodic agents which can be used are, we can use flavoxate is used, which is selective, especially it is selective for ureteric colic or dysuria or bladder colic. In all these we can use flavoxate. Then we can use dicyclomine as an antiemetic and antispasmodic agent, and it is used in dysmenorrhea also. But the drug of choice for dysmenorrhea is mefenamic acid is the drug of choice for dysmenorrhea, but dicyclomine can also be used for dysmenorrhea. Then we have pipenzolate. Pipenzolate is used in infantile colic. Then for hyoscine butyl bromide is an anticholinergic drug which is used for the abdominal pain which is of spasmodic type. For abdominal pain which is of spasmodic type, we can use hyoscine butyl bromide.
thank you and thank you for watching.